Hello students, this is Javed from Tixe schooling. Today we are going to discuss about biomedical ethics. Biomedical ethics is a system of moral values which are mostly used in clinical practices. So in biomedical ethics, our topic is core ethical practices which are mostly used. Biomedical ethics mostly depends on these four principles: autonomy, beneficence, non-maleficence, and justice. These four principles are the best pillars of the biomedical ethics. We are going to discuss each of them one by one. First of all, autonomy. Autonomy deals with the obligation to respect patients as individuals, truth-telling, and confidentiality. The confidentiality of his disease. If he allows the physician to disclose the information regarding his disease, we can. Otherwise, we are not allowed to discuss his disease with anybody without his consent. First of when patient comes to us, we must tell him each and everything about his disease. We should not hide anything about his disease, and this is called truth telling. These are the parts of autonomy. Informed consent deals with the choice of the patient. We have to tell the patient about the disease, its procedures, its medication, each and everything. He has the right to decide whether he is going to take the medicine, he is going through the surgery or not. He has pure choice. Second thing is beneficence. In beneficence, physicians have a special ethical duty to act in the patient's best interest. Beneficence may conflict with autonomy. Autonomy we have already discussed with confidential, truth-telling, informed consent. In autonomy, patient has the right to decide about his decide about his medication, procedure, or anything. But in beneficence, if there is any disease like a TB, sexual transmitted disease, or AIDS, physician can change his decision. Physician can do what is favor in the what would be in the favor of society, because TB is a communicable disease and can be spreaded through one person to another person. And if person who has autonomous right to decide about his disease, that he is not going to take the medication regarding TB, we should not accept his decision. We should go through what is best in the favor of society. Third thing is non-maleficence. In non-maleficence, what happens? Some diseases are cured in which there is a risk of treatment is greater than what the disease to the patient they have. So we have to take a full permission from the patients that you are going to through this procedure or not. In this non-maleficence, we are not going forcefully to treat the patient. We are not harming the patient. Whatever is best for the patient, he has the right to choose that thing, and we are not going through non-maleficence. The fourth principle is justice. In justice, we have to treat the people fairly and equitably. But here comes one thing which does not imply equally to all the people, just like triage. Now, whatever happens, for example, in justice, when a patient comes first, we have to treat that patient, and then second and third. But in triage, what is triage? We are going to describe what is triage. As we have described the justice, we have to treat patients fairly and equally. But when patients are coming, when there is a lot of casualties in the hospital, and we have to decide which to treat patients first. So there is a triage system. In triage system, patients are categorized in immediate resuscitation, 4 categories: immediate resuscitation, very urgent patient, and standard. In immediate resuscitation, we have to treat those patients, not to those patients which come in the category of standard. There are 4 colors: red, orange, yellow, and green, which are given to the patients on the basis of their casualty. So in justice, we have not included the triage. Triage does not come in the justice. As I already discussed about the triage system does not come into the justice. Justice does not apply to this triage system, because triage system mostly deals with the casualties. And in casualty, when we come, there are 4 kind of colors which we give to the patients, which are categorized on these cases. For example, red, orange, yellow, and green. These colors mostly These colors mostly describe the condition of the patient. The red color patients are more critical, so which need immediate resuscitation, which are dealt or which are being treated within minutes, not any 5 minutes, 10 minutes, 0 minutes. Immediately when they come into the hospital, they are mostly treated on the spot. And for example, we are giving to the time that the patient and the red color patients are coming in the hospital, how much, within which time we have to treat them, and the time is 0 minutes. Means patient comes and we have to treat him. Second thing is very urgent patient, which come in the category of the orange color. Very urgent patients are those which need treatment within 10 minutes. Within 10 minutes. These are very urgent patients. When these both patients come to us at the same time, then according to our triage system, we have to deal with those patients with the red color, very immediate resuscitation needed. Third thing is yellow color patients, which are called or which are being treated in 60 minutes. Means these patients do not require any treatment immediately or within 30 minutes. They can be stayed for 60 minutes. They can wait. But those patients which are coming in the category of the red color or which are coming in the category of 0 minute, they don't need any delay. Fourth thing is standard. These patients can be treated in OPD or anything else or within, you may say, 120 minutes. Okay, these patients can be treated in 120 minutes. They don't need any treatment immediately. They can wait for 2 hours, 3 or 4 hours, or they can be treated on next day. So this triage system does not come in the category of justice, although we have to treat patients fairly and equally. But when it comes to the casualties, we have to see that which are more prone to death or which are more critical patients, we have to treat them.